Hey class, welcome back. Um, Hopefully you already watched the ankle animated video. If you haven't already done that, please go back um, one slide in the module and watch the ankle animated video. So this week we are talking about chapter 19, the ankle and lower leg. For the anatomy part, I'm just gonna kind of breeze right through and talk about a couple things that I want you to know for quiz purposes, and then also maybe a couple things that he did not talk about in the animated video. Um, so we'll start with lower leg. Okay, so last week we were talking about the knee, and we talked a little bit about the tibia and the tibial plateau. Okay, so that stuff is in last week's module. This week, though, we want to continue down the tibia. Okay, so this whole long part of the tibia is the tibial shaft. And then we have the fibula. Okay, starting with the fibular head up by the knee, we have the fibular shaft coming down the outside of the leg. Okay, and then once we get down to the distal end, this would be the distal end of the lower leg. Okay, this is a picture without the foot, but the foot would be sitting right here. We have on the medial side, the tibia, on the tibia side, we have the medial malleolus. Okay, and that's the ankle bone on the inside of your ankle. He talked about that in the video. And then we have the lateral malleolus on the outside. So those are two things that you're going to want to know. You're going to want to know the tibia, you're going to want to know the fibula, and you're going to want to know the lateral and the medial malleolus. Okay, so that's it for bony structures that you need to learn from the lower leg. We'll go into the ankle. Okay, so this is a picture from behind the foot. Follow the tibia down, we have the medial malleolus. Okay, follow the fibula down, we have the lateral malleolus. Okay, and then what we want to know is that this segment right here where I'm running the mouse, this whole joint right here, is called the talocrural joint. Talocrural joint. Okay, we often call it the ankle mortise. Okay, and he talked about that in the video. But you see this kind of upside down U shape that's created by the medial and lateral malleolus, and that's what locks the ankle joint in place. Okay, so this is the talocrural joint. You're going to want to know that. And it's made up of the tibia and the fibula, specifically the medial and lateral malleolus. And then it is also made up of the talus, which is this bone right here. Okay, so this talus sits inside that mortise and creates that locked joint mechanism. Okay, and at this joint, we have plantar flexion and dorsiflexion. Okay, so as the foot comes up towards you, as your toes come up towards you, that's called dorsiflexion, and that talus is locking up into that mortise. And then plantar flexion, when you point your toes away from you, is when that talus drops down out of the mortise, and that is plantar flexion. Okay, something we know about ankle injuries. It's much easier to injure your ankle when you're in plantar flexion, and the reason is because of this mortise. When you plantar flex, the talus drops out of that mortise, and now it doesn't have that bony stability. So many ankle injuries occur in plantar flexion. Okay, specifically plantar flexion and inversion, which is when you turn your toes inward toward the medial part of your body towards your midline. And that is because the medial malleolus doesn't come down as far, which leaves space for that foot to roll in. When that happens, we end up injuring the outside ligaments of the ankle. Okay, so the foot rolls in, that's inversion, and the outside lateral ankle ligaments are injured. Okay, plantar flexion and inversion is the most common way to injure the ankle. Okay. Then below the talus, where the talus and the calcaneus come together, is called the subtalar joint, and that's where that inversion and eversion occurs. Okay, so when the foot rolls in, it's occurring at this calcaneus and talus joint, that subtalar joint. Okay, moving on, we'll talk about some of the ligaments. Okay, he hit the main ligaments that I want you to know in the video, in the animated video. So really I just want you to know this lateral ligament complex on the lateral side of the ankle, posterior talofibular ligament, the calcaneofibular ligament, and the anterior talofibular ligament. And those three are right here, okay? So it may seem confusing, but the names actually describe where the ligaments go, which is actually really nice and helpful. Okay, so calcaneofibular ligament goes from the calcaneus to the fibula. The posterior talofibular ligament goes from the talus to the posterior side of the fibula. And the anterior talofibular ligament goes from the talus to the anterior side of the fibula. Okay, so the names help you to know where they are. All right, and then on the medial side of the ankle, we just take this whole big, it's really a band of ligaments, a complex of ligaments, and we call it the deltoid ligament. Okay, and there are different aspects of it that are named, but all we need to know is that this whole big area of ligaments in here is called the deltoid. We call it a fan of ligaments or a band of ligaments, but it's just one big bundle altogether. Okay, talking about the muscles. He hit in the video the main muscles that I want you to know. The gastrocnemius. I'll start down here in picture C. The gastrocnemius is made up of two heads. Okay, a medial head on the inside of the calf and the lateral head on the outside of the calf. The gastrocnemius and the soleus, and here in picture D you see the soleus. This is just underneath the gastrocnemius. Okay, so this is more superficial, you can touch it. The soleus is right underneath that gastrocnemius. And both of those muscles feed into the tendon. It's called the Achilles tendon, really. If you wanted to be specific, up here it's the tendon of the gastrocnemius, and next to the soleus it's the tendon of the soleus. But really you can call this whole band the Achilles tendon. And that wraps down underneath the calcaneus and attaches on the bottom portion of the calcaneus. Okay, so the gastrocnemius helps us do plantar flexion. So does the soleus, helps with plantar flexion, pushing the toes down away from you. Okay, on the front of the shin, so that was all on the back of the calf. On the front of the lower leg, on the shin, we have this big muscle right here. Easy to find if you find the hard part of your shin bone, and then you go just outside, just lateral to that. There's a big, it's softer, but it's a big muscle, and that's your tibialis anterior, and that pulls your toes up towards you, or dorsiflexion. Okay. Then the two other muscles that I want you to know are the tibialis posterior. Okay, so this is the tibialis anterior, does dorsiflexion. Tibialis posterior runs just on the inside of your shin. So if you found that shin bone again, tibialis anterior is on the outside. The tibialis posterior is just on the inside, kind of underneath all that gastrocnemius and soleus and stuff like that. And that helps with inversion. Okay, the tibialis posterior inverts, pulls our toes in towards our midline. Okay, then on the outside of the calf, we have the peroneal muscles. You see peroneus longus and peroneus brevis. Depending on where you look in literature, they've renamed them to fibularis longus and fibularis brevis. I see peroneal, the word peroneal used more often, so we're going to use that for this class. So the peroneal muscles are on the outside of the lower leg. They run all the way down the outside of your lower leg and then into your foot, and they have 2 attachment sites. But the peroneal muscles do eversion. They pull the toes out away from the midline. So peroneals for eversion, the posterior tibialis for inversion, the gastrocnemius and soleus for plantar flexion, and the tibialis anterior for dorsiflexion. Okay, so that's our anatomy. Something we want to know is that the ankle is a very stable joint. The bony anatomy makes it that way, so dislocating the ankle is actually very difficult. Something else that we want to know is that the shape of the talus and the malleoli creates a mortise. Okay, so we want to know that mortise is the term that we use for that ankle joint. And the most stable position for that mortise joint is when you're in dorsiflexion. Remember, dorsiflexion pulls that talus up into the mortise. That's a compact, stable position. Okay, and remember, when the talus drops out of that mortise in plantar flexion, it becomes unstable. All right. In the next video, we will get into some of the rehab techniques and exercises. If you guys have any questions, please post them to the discussion board. Other than that, have a great rest of your week.